Medigroup Physician Services presents Medigroup's Frank's Fast Five with Healthcare Executives, produced by Bridget Wilson and Carrie Peters. Today's guest is Diana Hall, President and CEO for ActivArmor. Now, here's your host, Medigroup's Frank Gillespie.
Well, hello and welcome to another edition of Medigroup's Frank's Fast Five. Today, I have the privilege of talking with Diana Hall, an entrepreneur that I've had the pleasure to work with in developing a great agreement for Medigroup's members. Diana is President and CEO of ActivArmor. Diana, it is an honor and welcome. How are you?
Thank you so much for having me on. It's a pleasure.
Of course, absolutely. I was looking forward to this. So appreciate it very much. Appreciate your time. So I promised you we wouldn't waste your time. So I'll just jump right into these questions if that's okay.
Sounds great.
Thanks. Diana, could you share a bit about your experience in the healthcare, software, and technology industries? Various roles you've had up until today.
Absolutely. It's funny how you go through life and you have these certain experiences and education, and then you don't realize how it's all going to come together until it does. And so I'm actually a chemical engineer by trade. And when I worked in chemical engineering, I learned about material science and how to test strength and for things like microporosity and biocompatibility and things like that. I didn't know how that would play into my career in the future. And then I moved into software engineering, and not to date myself, but this was way back in the .com boom when right at the end of the 90s, right when they were having a lot of telecom. And so I studied software engineering because I really liked the high tech and the simulation and labs and things like that. And so I worked in that space. I worked in Fortune 500 companies in both engineering and software. And then when I took some time off to have my daughter, I started running a mentoring program for children in poverty. And they would have domestic violence and substandard living conditions, and they'd often have these filthy casts on they'd get bed bugs under them, or it would get wet, and then they would keep that against their skin. It would get stinky and dirty, and you'd have to. One little boy had permanent scarring on his arm after wearing his cast, and the kids just couldn't even practice basic hygiene like washing their hands to have a snack. So I developed a 3D printing process for 3D printed exoskeletons that could be made in waterproof, hygienic, breathable plastics like this one, which is in the same as Legos. And I made that for them, and I said, take this to your doctor, ask him if you can wear this instead. And the doctors came back and said, can you make me some more of these? And that was back in 2014 when the company started. We're now all over the country. We're in 11 other countries as well, in top hospitals in the US and abroad. So we're excited to be expanding because people really saw that it was a market need. And that's how my education and experience all came together to be able to bring this new product to market that really fit a need, especially during a pandemic. If you can't practice basic hygiene, like washing your hands, that's a real problem. And so it really just came to light because of the timing.
Absolutely. What a fascinating background. And I think you covered some of this already in my second question. Are there any other things you'd like to share about how you came to create and launch ActivArmor background-wise?
Yeah, well, I grew up in Children's Hospital because my brother had cystic fibrosis. So I spent a lot of time there, and I saw kids having to adapt to medical devices instead of the other way around.
Sure.
And I understand how, custom devices were so needed when you're doing body fitting type of devices, right? Because there is no one size fits all. It's not extra small through extra large, right? And people's injuries and conditions are different. They might need to be immobilized in a different position. They might need it coverage area in a different spot. You might need it thicker or thinner based on your lifestyle. An older lady knitting all the time with carpal tunnel is going to need an immobilizer completely different than an NFL player with a fracture on the field. So that means that it can't be standardized how we treat patients for immobilization. And
Sure.
Lifestyle freedoms. You need to be able to wash your hands. You need to be able to get wet, ice bath, use a bone stimulator, a muscle stim, TENS units, biomonitors, whatever to reduce your pain, your opioid use, and improve your healing outcome. Technology was ripe for disruption, and that's where I came in.
Fantastic. It's a fascinating background. Diana, you're displaying one now on your arm, and this wasn't one of my questions, but do those come off? Can they come off and then snap back on? Is that how it works, or?
Up to your doctor.
Oh,
So
okay. Okay.
like a cast, you can see this walking boot we have, which is amazing for Charcot foot offloading. It's a great value over custom offloading pro boots that they have
Sure.
now. It's washable, waterproof, breathable, hygienic, sanitizable, all of those things. You can observe and treat the skin. It's adjustable for swelling, and you can actually take the little walk your boot off, and then you can go swimming, you can take a bath, you can do all of those things. And these are offloading, and research studies show that offloading diabetic wounds and ulcers will actually reduce mortality rates and
Sure.
amputation in the patient. So because these are fully custom in design, you can do all kinds of things like that. You can have it locked on like you see here for compliance, and it can also still be spaced and bivalved for swelling, or you can have it be removable like I'm wearing here with this little bungee system. And then this is super easy to remove. I wear mine for carpal tunnel personally. And it's
Oh, wow, it just slips right off. That's very amazing.
this exact splint on for 5 years on and off when I need it for carpal tunnel. A lot of our patients use them for fracture care, and they any body parts. You can see like hand-based, thumb spikas, long arms, wrists, whatever you need. They're custom fitted and designed specifically for that patient.
That is amazing. And how long does it take the 3D printer to develop or make one of those? I guess it depends on the size of the cast, but
yeah, this one's about an hour. This a 3-hour print. And this one, I usually start walking boots or long arm casts before they're there in the morning. So, like you said, it takes longer depending on the size.
that is amazing. I love it. Well, Diana, what are some other considerations, if any, that you had to explore in bringing the 3D printing technology to the market? Were there some issues that you had to deal with?
Yes, absolutely. And I actually worked directly with the FDA and Robert Fischel Medical Device Institute at the University of Maryland to help develop some of the test protocols for 3D printed wearables and medical devices. And you can see some of those research studies in our white paper that's listed on our website, but also at the major trade shows, AAOS, ACSM, et cetera. So some of the things that you want to look for when you're making medical devices with additive manufacturing is microporosity, for example. Are there any tiny cracks or holes or gaps anywhere in the finishing process that will trap moisture or bacteria against the skin?
Okay.
Want to make sure that's eliminated. And I'm talking about the micro level. So you're going to want to look at it with a microscope, and you're going to want to do certain tests to prove that the product is non-penetrable, non-porous, and all of that. And it really depends on the manufacturing process and the materials and the finishing process, right?
Okay.
So all of that comes into play when you're manufacturing medical devices, as well as biocompatibility. And you would think that melting plastic that's biocompatible, that's ISO certified, ISO 10993-5 certified for biocompatibility, cytotoxicity tested, would just changing the shapes of it would not change the chemical structure of the actual product, but it does. And that's important to know and to test the biocompatibility post-processed as well as the raw materials. And so things like that, and then application, like what are the use cases and how are the best healing outcomes, and how do you get the fitment to be perfect so that it immobilizes well, so that you really that movement that will cause a displacement or not promote healing, but also how is it adjustable for swelling, right? You don't want compartment syndrome, for example, your skin to pooch through these holes, and you don't want to have window edema. So all of those things are very important in the healing phases when you're dealing with acute injuries, right? You want to make sure that it's accurate but still adjustable. You want to make sure that it's patients, and the manufacturing process has to be very tight. And so the evolution of the company shows that, right? It shows, us spending a lot of time in research and studies and test cases on patients and, clinical studies and things like that, to the evolution of how do we now make the designs better for the patient's lifestyles while still providing the protection and the support that are needed. And that's the cool thing, is the doctors have to have autonomy in how thick or thin the device is, where the coverage area, where the exposures are, how it fits, which digits are immobilized and in which position for the patient, right? So all of that is important. And if they don't have control over that process, then the product, that's why we do casting, right? That's why it's been the same for 200 years, is because you take some material out of your drawer, whether it's plaster or fiberglass or whatever, you wet it and you put it right onto the patient, you mold them into it. That's always been the standard of care. And then you have a cast saw and you saw it off every time and replace it, right? And so the next generation of that is custom design, where you can say where you want holes. You can use a bone stimulator, a TENS unit to reduce your pain, and meaning that you can reduce your opioid use, right?
Sure,
and long-term.
Sure, that's huge.
Bone stim so that you can heal in half the time, muscle stim to reduce your rehab time, things like that. So those new technologies, the biomonitors, things like that, are what are changing the landscape and the culture of immobilization, as they should.
Sure, fascinating. Is it always the same plastic that you use? It's just a different thickness or a different, but it's always the same plastic material, or are there different plastic materials? No.
Yeah, there's different plastic materials. Now, the one that I'm wearing right here is ABS plastic. It's the same as Legos.
Okay.
It is compatible, unporous, all of those things. You can even sterilize it. So cold sterilization, not autoclave, but you can cold sterilize surgical plastics. And then doctors and nurses are wearing them. They're getting back to work. Workers' comp loves us, right? Because they're, able to get their folks in food handling or healthcare or whatever back to work.
Right. Cool. Fascinating. I love it. And of course, I'm going to ask this question. How does working with GPOs bring value to your team and your representatives?
Well, the great thing is that it brings exposure of our product to a broader audience, right? So we are able to work with your GPO and your group so that you guys can get discounts in knowing that these products are better for your patients and for your group and your buyers. So we want to make sure that our products bring value and that there's visibility to those products so that more people can have access to them.
Absolutely. And especially a unique product such as this. I mean, I find it fascinating when I look at your website and see all the different variations. It's really amazing. Diana, last question. What are some challenges you've faced over the last few years, and how have you overcome them?
Yes. So one of them has been, how do we manage growth and how do we change the culture? So with the changing the culture, like I said, we've been doing the same thing for hundreds of years, is in immobilization. So to say, hey, now guess what? Instead of, just wetting some fabric and putting it on your arm, wait till it dries, saw it off. Instead of that, we're going to take a free iPhone app. We're going to take your iPhone, a smartphone, and we're going to do a digital scan of your body. And then we're going to either order a fabricated custom device from one of our third-party manufacturers to be shipped to you in 4 business days or less, that's fully custom, or you can fabricate right there on site with a 3D printer. You can have your own 3D printer, any 3D printer you want, or you can purchase ours that print this in 3 hours. And they're affordable printers, which you can have on site. And then we just provide you custom design services, and you guys can, pop out custom devices all day long in your clinic right there at point of care. That model is brand new, and really what we're trying to have physicians see can become the new standard of care. It's better for their patients, it's faster, it's cheaper, those things. So we want to make sure that they understand that and that they are open to accepting technology. And that's the culture change that I'm talking about. It's like, we've done this is how we've done it, and we understand it, and it's low tech, to this is high tech. There are a lot of benefits to it, but there's a bit of a learning curve. You got to, use your iPhone at a minimum, and also then potentially 3D print if you want to on site, but at least understand that, accept that. So that's been one of the challenges, is to introduce a new digital technology into an old school market and have people embrace it fully. That's definitely one of the challenges we're still working on.
Absolutely. Well, you certainly cast things in a great light, that's for sure. So I'm sure you've heard that before too. But really appreciate it, Diana. Thank you so much. And it's a fascinating product, and encourage our members to take a look at it, and others that may be watching this presentation to make a consideration for ActivArmor. What a great product, and what a great lady that's got some great background. Diana, thank you so much for your time today. I really appreciate it. Look forward to working with you in the rest of, during the rest of the contract. Thank you so much.
Thank you, Frank. Bye.
Bye-bye. Take care.
This has been MediGroup's Frank's Fast 5 with Healthcare Executives, produced by Bridget Wilson and Carrie Peters, and hosted by Frank Gillespie. Special thanks to Diana Hall, President and CEO for ActivArmor. This has been a presentation of MediGroup Physician Services.